So we're about to start another lip-nose combination surgery here. As you can see, patient has had surgeries done elsewhere and there's a lot of issue, especially with the lip. We're also going to show you the problems with the nose. She has a pretty small nose, to her face. So we're going to be making it more proportional. Plan is to increase the height, increase the projection of the nose, and at the same time decrease the width, so which is going to give much improved look. This is how she looks at the side view. We're also going to show you the most challenging view for patients like this, where the nose, you can see, is tilted towards the left side. So there's issues with the muscles around the nose, muscles around the lips, scars on the lip, bone on the nose, cartilage. It's going to be a septorhinoplasty with rib harvest, a lip revision with muscle reanastomosis. So we've just completed now with this lip and nose work. I'm going to show you the different views, but so we've achieved reasonable symmetry on the nose, perfect symmetry on the lip. Scar was revised, the notching was removed, the asymmetry in the nose was rectified. The nose is being made slimmer, taller, the projection has been increased, augmented. Rib was needed, so the harvested rib grafts. This is the basal view where you can see that significant improvement from before. I'm going to start you with a pre-op picture as well. Okay, show the front view. So that's the front view. Okay, side view.